everyone. So for this video, I will be showing the steps that you need to do during trauma assessment.
So first is to determine the mechanism of injury, nature of illness. So the mechanism of injury of the patient is injury from motor vehicle accident. So next is determine the patient, and after that request for additional EMS response. And based on mechanism of injury, considers stabilization of the spine. Next is a verbalizes general impression of the patient. So the patient is a 25-year-old female who has been injected from a motor vehicle accident. And now, next will be determining the responsiveness and level of consciousness of the patient. So, Miss, are you okay? So my patient responds to pain stimuli. So we're gonna go ahead and assess ABCs. So assess patient's airway. So there's nothing in her airway. Next is RR. So the respiratory rate is 30 beats per minute. So, and I'm gonna also auscultate lung sound. My patient has decreased breath sound on the left side. I'm gonna go and put her on high flow oxygen with a non-rebreather mask. So next is circulation. Patient has a radial pulse. She has a weak radial pulse, 130 beats per minute. Assess and control major bleeding. So the bleeding is minimal. After that, assess for the skin color. The patient's skin was pale, cool, and diaphoretic. And next is identifies patient priority. Make treatment or transport decision. Attempts to obtain sample history. Then assess patients from head to toe. The head, the face, and the eyes of the patient if the patient's pupil is reactive to light. Check the ear, inspect neck, check the chest for the rise and fall, palpate the chest, palpate the abdomen, palpate the pelvis, palpate the upper legs and lower legs. And assess dorsalis pedis pulse and radial pulse for completely assessment. After the head-to-toe assessment, it's now time for the vital signs. So the vital signs of the patient: blood pressure 90/60, pulse rate 98 beats per minute, and respiratory rate 22 beats per minute.
So after that, continue reassessing the leg, distal pulses, and continue reassessing vital signs every 5 minutes because she is a critical patient. So that's all for today, and thank you for watching.